I'm Dr. Amy.
And I'm Ashley.
And we're going to get you back in the game. Hi, everybody. I'm Dr. Amy.
And I'm Ashley.
Ashley, what are we going to talk about today?
So today we're going to talk about how to prepare for your surgery. So Dr. Kanata, how would you prepare for your surgery?
That's a great question. If you're watching this video, hit pause. Go grab a pen and a piece of paper because we're going to be sharing a lot of information with you on how to prepare for your surgery. So hit pause, go grab a pen and a piece of paper, and we'll be right back. And we're back. So we're going to give you a timeline today to prepare for your surgery. 3 months out, you're going to want to make sure that you stop smoking. The reason for this is that it reduces your risk of pneumonia after surgery. The other thing that you're going to want to start doing is eating a well-balanced diet that's low in sugar. This will also help prepare your body for surgery and the recovery after.
10 days before surgery, if you're on blood thinners, you want to talk to your cardiologist or your primary care about discontinuing taking those prior to surgery. If you have any loose rugs in your home, you want to go ahead and remove those to reduce your risk of falling. That is the #1 risk after surgery, is falling, so we want to go ahead and take care of that. And to add to that, you want to get a night light in your bathroom. That way, again, just to kind of get rid of that risk of falling. Make sure that you have a stable chair at home with a comfortable cushion. Again, that's going to become your best friend. Make sure that you also have 7 days prepared of cooking, cleaning, shopping, again, just getting your home ready for at least a good week after surgery, having that preparation. If you don't know the plan, go ahead and contact your nurse here at Phoenix Spine and Joint, and they can go ahead and walk you through all of that if you're not sure on what it is that you need to talk with your doctor about or what to do around your home.
2 days before your surgery, you're going to want to prepare your ride home from your surgery. The reason being is that you've been under anesthesia, and so for the next 24 hours, you want to have someone stay with you, give you a ride home, and make sure that you're okay after your surgery.
So 1 day before your surgery, you want to stop eating after midnight, nothing by mouth, no chewing, sucking, anything like that, and no liquids 4 hours before surgery.
Okay, so now we've come to the day of surgery. First thing you want to do is make sure you take a bath or a shower using chlorhexidine gluconate 4%, which you can find at most drugstores. You want to make sure that you're focusing on the body part that is going to be undergoing surgery, and make sure that is very clean with that chlorhexidine solution. One of the biggest risks after surgery is getting an infection, and that is caused actually by the bacteria that's on your skin the day of surgery. So it's really important that you make sure that your body's nice and clean using that chlorhexidine gluconate. You want to make sure that the day of surgery, you bring all your medications, including your CPAP machine and your inhaler, the day of surgery, and give it to your nurse here. The morning of surgery, you can take your AM, your morning medication with just a tiny, tiny sip of water as needed and as directed by your doctor and your nursing staff here at Phoenix Spine and Joint. Last but not least, make sure you wear loose, comfortable clothing and comfortable shoes so that you can easily get dressed after your surgery with very little effort so that you can make your way home. If you've made it this far, congratulations, you're on to your surgery, and we're looking forward to seeing you for the post-op portion of our videos.